Today on The Reality Pill, we have an amazing surgeon, Dr. J, also known as Dr. Payam Jaranejad, who specializes in incredible Brazilian butt lifts, fat recontouring of the body, and breast implants. Today we're going to put our focus on Brazilian butt lift, what it means, what the reality of it is, and how to avoid issues for both patients and surgeons as well. So please listen closely. We've got some beautiful photos and results to show you. I'm so happy to have this doctor here today. He's a neighbor of mine, fortunately in my building. We have known each other for quite some time, and he's one of the few people in the world that I do send my friends and family to. So thank you so much, Dr. J, for being here. Tonight, our goal is going to be to talk about the realities of his world. And in his world, we have what we call Brazilian butt lifts, or fat contouring, fat repositioning, fat transfer. There's a million things you call it. And he specializes in a very natural way of doing it, and wants to educate us about the realities of what to expect when going through this, all the risks, all the realities of it. So Dr. J works in my building, which is fortunate enough. Before I moved into that building, I knew of his work. I knew of him, and I loved his work. And I moved into the building, and surprisingly, he's a couple floors up from me. So since then, we've become really, really good friends. And
pleasure.
Yeah, and I sent him tons of patients who already know about him. So it's nice and easy. Everybody trusts you and loves you. So why don't you kind of get started? Tell me about the world of the butt lift.
Well, thank you for the beautiful introduction. It takes one to know one. And we have plenty of mutual patients, and they're all very, very happy. And it's just a great feeling to know someone who does a similar type of work as I do. Well, where do you want me to start? I mean, I wish we had rehearsed this. The good thing, probably the best part is we did not rehearse anything. So that's the best part. We had some computer issues, but everything else, no rehearsal. Where do you want me to start?
So I got tons of questions from my patients, and I get them all the time asking about the difference between a liposuction specialist and a fat transfer specialist. Is there a difference?
Very good. It's a major, major, major difference. So liposuction, basically sucking out fat. Anybody can do it. Unfortunately, we have even pediatricians do liposuction. Fat transfer, it's as you very well know, it's a process. It's just not transferring the fat; it's turning the fat into stem cells. Just turning the fat, the liposuction fat, or in other words, the lipoaspirate into stem cells, which we can transfer. It is a process, and liposuction plus fat transfer to the buttock is another name for Brazilian butt lift. Now, Brazilian butt lift, the nomenclature is very interesting. Brazilian butt lift. Let's dissect that a little bit.
Does it make you look like, that's what I always want. Does it make you look like a Brazilian? Which is a good thing. It'd be fantastic. That's what everybody wants to look like.
Well, not all Brazilians have a nice butt. So hopefully that's not what it means. Brazilian butt lift, commonly it's a myth. Mostly they think it's because you make the butt look like Brazilian butts. But it actually has a nice history. It's pioneered by Brazilian plastic surgeon. And that's why it's called the Brazilian butt lift. Ivo Petangai is a plastic surgeon who pioneered a lot of plastic surgeries we do. Even like facelift, he modified a lot of facelifts as well. He actually operated on the burn on Niki Lauda, the famous Formula One driver. So operated on a lot of celebrities and a lot of world leaders, actually. So that's where the Brazilian comes from. The funny thing is, the other part of the name, it's lift. As you very well know, when we talk about lifting, it's usually skin excision. Like when we do a facelift, for example, or a neck lift, or a breast lift, or an arm lift, or a thigh lift. It implies that we are lifting, but there is no skin excision in a Brazilian butt lift. So basically, the lift, it's accomplished via the fat transfer and augmentation, and that will lift the buttock and give the buttock a natural butt lift. So, or no, in other words, a Brazilian butt lift.
Mm-hmm.
In my way, just like as you do, which I think that's the main reason we have so many mutual patients. You and I like to keep things natural, because once it looks artificial, it loses its beauty. It's not beautiful anymore. When everybody can tell you had plastic surgery done, or this is not actually you, or doesn't go with the rest of your features, it's not beautiful anymore.
Yeah, and so, before you get into how we're doing it too, I'm also curious the alternatives. And the alternatives, from what I understand, there's a surgical alternative of actually cutting and lifting, so body lifts, thigh lifts. But then, what do you feel about implants and injectables? Injectables meaning silicone, Sculptra.
For sure. Very well. So now that we got the definition of the Brazilian butt lift down, and the way I do it, it's a natural way. So I name it natural butt lift. And that's how I do it. I keep it very natural. So they move natural, they look natural, they feel natural. And basically no one can tell there's been anything done aside from the proportions, but the look itself. Now, there are three ways to augment a buttock. That's why implant placement in the buttock, it's not called a butt lift anymore. It's a buttock augmentation. Mm-hmm. Or when we place fillers in the buttock, it's called buttock augmentation. It's not a butt lift, natural or Brazilian butt lift anymore. There are three ways of doing it. One is just simply placing implant. You rarely can find a reputable. Well, I can't. Putting it in nice words, there are not many plastic surgeons, board certified plastic surgeons doing implants for buttock augmentation. The risks are basically prohibitive. It's not going to look as natural when you place an implant in the buttock.
And they feel weird.
Yeah, they feel weird.
They feel weird. They look weird.
Correct. Absolutely correct. They feel weird. They move really unnatural, especially if it's not placed exactly in between the muscles where it's supposed to be. The dissection is very tedious. And the problem is once these patients run into complications and you need to remove the implant, these patients were patients who didn't have enough fat to begin with. That's why most likely they opted to have an implant. So when we remove the implant, our choices are not many, to say the least. We can't place fat in, and already there's so much scar tissue, it's not even a good candidate for fillers, which we're going to talk about. So I don't do it in my practice, and we've removed many buttock implants, and we've had to use other ways of lifting the buttock, be it fat transfer to the buttock. We find any fat we can from anywhere. And at the same time, we had to actually make an incision to lift the buttock and remove the stretched skin. So it's not something I do, and I wouldn't recommend as a first choice. The other option that you mentioned very well is fillers. Fillers, we have hyaluronic acid, Sculptra. Silicone is being placed, but as you know, it's not FDA approved. It's actually illegal.
So how illegal? How bad? Because I know people, friends of mine, who have gotten it, and I try to explain to them that it is one of the worst things you could ever do. Not only could it really be a health risk in terms of killing you, but almost certainly it's going to destroy your ass in the future.
That's
almost
right.
Certainly.
Yes. This silicone, when something is not FDA approved for usage, obviously there's no follow-ups. There's no control over it. So what happens, we don't know what type of silicone. I've had patients come from South America, based on my experience. We don't even know what this was. I mean, they call it silicone because patients would be familiar with the word silicone because they hear it being placed in the breast or as a chin augmentation or other augmentation with that type of silicone has a shell around it, but these are injectable silicones, and the lab comes back as silicone, but we don't exactly know what type of polymer these are. So the risks are prohibitive because this amount of migration is high. It could migrate into the vessels, and from the vessels, it can take it to the lungs and cause obviously death, or as a foreign body, it could cause a reaction, and it could get infected. And that's when patients really end up in hospitals, and it's really, the risks are really prohibitive. So definitely not a choice here in the United States by any means.
I feel like if you're going to go to a doctor who does silicone injections, you may as well skip to Dr. Kevorkian.
Yes.
Let him just finish the job for you
That's
properly.
Right. Right.
And what about Sculptra? Because Sculptra I see is a very popular option now.
Yeah.
I've seen it work for small indentations, and I think it's great for that. But what are your feelings on kind of overall larger volume augmentation with it?
I agree. Sculptra and very experienced hands can be used, but the cons are that first of all, you have to repeat it. And it's a large amount that you would have to do, and it at least takes 2-3 sessions. It has to be an experienced hands, and again, as you well know, it could migrate and it could have scar tissue around it. I don't advise it for high volume, but if there's some irregularities, or like some patients who come like with severe cellulite that we have to release it and we have to place something underneath the cellulite so it won't recur. In my hands, fat is the best option, but Sculptra, very good option. Very, very good.
And what do you do with the really skinny girls? Because we're in LA. LA is filled with these girls who, no matter how beautiful they are or how fit they are, they want some booty augmentation. What do you do with these skinny ones?
So with the skinny ones, first of all, we keep it candid, and I try to go over all the areas that we can take fat out. Sometimes when I mention areas, especially with the outer thighs or inner thighs or the arms, the patient's like, I didn't even know we could take fat from those areas. And I've turned down a lot of patients because at the end of the day, I want to do something that both the patient and I are proud of. So yes, if there are skinny patients, I would just simply say, you're not a good candidate, or in my hands, I can't really be of much help because I don't believe in implants. And, if you want to do Sculptra, it's going to be multiple rounds of Sculptra, and I go over the risks and benefits. Mm-hmm. And sometimes they choose to have Sculptra, and sometimes they just say, okay, just take whatever fat I have, because the least I get is some lipo-contouring and lipo-sculpting. So that's something you get anyway, that you're not going to get by a Sculptra or injectables.
Right.
So,
and do you think it's fair to say that in contrast to breast implants, you likely have more limitations on who you can do this on because of that? Absolutely.
So, yes. So implants, silicone implants, obviously, they work amazing for the breast. Did you want me to compare it to the fat transfer to the breast? I can give you a quick comparison. Yeah.
Yeah, actually, if you don't mind.
Okay. Yeah. It's a very common question. We get that a lot. Like as you very well know, in plastic surgery, just the principles of plastic surgery is that we replace like with like, and that's how it works. So that's why fat transfer to the buttock works amazing, because you're placing fat inside the fat, and it revascularizes. It works very well. You must put the fat over the muscle. Obviously, you have to put it where there's fat. And the complications from fat transfer to the buttock actually arises when inexperienced surgeons put it underneath the muscle, and that's how it gets into the vessels. Now, in the breast, we have two types of tissues. One is the fat tissue, but the other is the hormone-sensitive, milk-secreting, milk-producing breast tissue, the real breast tissue. Mm-hmm. So that's why the failure rates in fat transfer to the breast are much higher, or not failure, but the take is less. So again, in the breast, the chances of you repeating the procedure is much higher. And I usually recommend it for patients who actually have enough fat for second round or third round fat transfer to the breast, or for patients who actually will be happy with going a cup size larger, a very, very modest enhancement of the breast. And at the same time, they do have enough fat. So when we do the liposculpture, we can use it for the breast.
And I've heard of a lot of doctors. I haven't heard of you really doing this, but I've heard of a lot of doctors who prime their patients, meaning if they're thin, they tell them to gain weight to get the fat and then do the transfer.
Very good question, Ben.
Which is very confusing.
We didn't rehearse this, but they're really good questions. That's very good. I'm confused as you. And unfortunately, we have a lot of board certified general plastic surgeons who advise it. And I don't get it, because we are plastic surgeons and we care about aesthetics, but first and foremost, we're doctors. So the health of the patient should be of utmost importance, should be a priority. So I just can't see myself tell a patient, go eat unhealthy and gain some weight, because part of that fat, as you know, will go into the coronary vessels. It'll go to the heart. So it'll cause cholesterol plaques. So you're basically decreasing your life expectancy to just give me more fat so I can do your fat transfer. It just doesn't. Oh, and another major issue is when patients gain weight, it's really not in our control where the weight will go or where they accumulate this fat. It could go inside the body, like intra-abdominal fat, visceral fat, or omental fat. Three names for the same thing, which is a more readily available fat inside, beyond the rectus abdominis and the fascia, beyond the muscle. So as you know, we can't even remove that through a liposuction, or it may go in places that we don't want to look larger, and there's no control aside from the health issue.
Right.
So,
the implications I see, number one, for health, obviously it's a concern. The other is you're going to gain weight in an unstable way, which you're going to lose, which means whatever fat you grafted could also shrink. And the other is that you grafted somebody at an unstable time point. So you don't really know, as far as really perfect contouring goes, what's going to happen in the next year or two as their weight fluctuates again.
Absolutely.
And so does that, so how do you take that part into account? Let's say a patient comes to you, and do you go through the history of weight fluctuation? And do you talk to them about future stuff? Like, you might gain weight in the future. This might happen. You might have a hormonal spike in the future and your fat might react differently. So how do you talk to them about that?
Absolutely. So all my patients, every single one, even when we respond to the comments on Instagram, are the buzzwords are stable weight. So I tell them, even if we have a lot of patients who are in the process of weight loss, be it through diet and exercise, or be it through bariatric surgery. And so I tell them, and they come in the middle of their weight loss within the first 6 months after the bariatric surgery, be it Roux-en-Y gastric bypass, lap band. I used to do them as a general surgeon a while back in New York, as a general surgeon. But, so I tell them all, you need your weight to be stable. And that's when you should have any plastic surgery, in my humble opinion. Because one major thing is, even if the patient, for example, based on what you just asked, which was a really good question, if a plastic surgeon or whoever tells the patient to gain some weight for your buttock enhancement, these patients will gain weight in many areas, including inside the tummy, and then we do their lipocontouring and fat transfer, and then they want to bring down the fat inside the tummy through weight loss, and then they're going to be in this predicament. So what's going to happen to the fat I just placed in my buttock? So weight stability or stable weight is the main principle of any type of plastic surgery, mostly liposculpting, lipocontouring, and fat transfer.
And fat transfer, along with all injectables, I feel like, of the face too. I mean, we're injecting things, so there is some sort of touch-up rate.
Yes.
So the two things that I'm wondering about is, one, like, do patients have to be aware of that and say, you know what, like, I might have to touch this up. You might have a little this, a little that. And the other is, when you're doing multiple procedures, how do you stage them?
Very good. So mostly when it comes to body contouring, the staging would be, first, we use up all the fat the patient has for two reasons. One, it'll give us the best opportunity to do the sculpting, right? Because a good plastic surgeon knows where to leave more fat and where to take more fat. It's in our hand. It's not like Cool Sculpt, which they put an applicator and God knows what's going to happen to that fat. Sometimes they have like a paradoxical hyperplasia, as you know. So a good surgeon knows exactly where to be more aggressive with the liposuction, where to be more conservative with the liposuction. So we do the liposuction at fat transfer first. Mm-hmm. And at a second stage, which is usually when the swelling has subsided enough for the patient to be able to have a second surgery. Generally speaking, I tell my patients 3 months. Rarely we have patients who come from out of country and, we have to do it earlier than 3 months. But generally, I think 3 months is a standard time for the swelling to subside. And then we do their tummy tucks and remove all the loose and excess skin. This is mostly for patients. They do have extensive amount of stretch marks to begin with in their tummies. So we use the fat on the first stage. On second stage, we do their tummy tuck or their mommy makeover, which is their breast aug lift and their tummy tuck at the same time.
Mm-hmm. And when you do that, do you find yourself sometimes just touching up the injections?
Yeah,
contouring it a little bit, or
sure, it's the best opportunity. Absolutely.
Okay. Now, if you were to go through a couple of these photos with me, sure. There's a big change in how the volume is distributed.
Yes.
And it doesn't even look like the same person. It's, to the right is what I would want my body to be like. And then, so what did you do here to get that?
Well, thanks for picking these photos. This patient, I appreciate you showing this because this patient had a tummy tuck by someone else, by another surgeon at another institution. So this is a reverse. This is not the way we usually do it, or anyway, anytime, not usually. This patient already had a tummy tuck in the past. I don't know. Can you see my pointer or no? You can't see with the pointer, can you? No.
No. It's on my screen. I go like this.
Okay, yeah. So you can see the scar. You can see the scar to the patient on the left side. So that was from a tummy tuck in the past by another surgeon. So in this particular case, as you can see, the liposuction has improved that the step off that you see from the excess skin, which the patient developed afterwards, or maybe she had it from before. So you can see we contoured the tummy with just a liposuction. We use the fat we got from the back and the sides, and we enhance her buttock. The main thing with the buttock, the natural butt lift, is to improve on the patient's hips, because when you fix a hip dip, you have to do it in a way that you place the fat in the buttock. You don't place the fat on the sides of the body because it's going to look very awkward from the back. So that way the patient looks taller. Proportionately speaking, the legs will have a much longer appearance to the torso. So it's going to give the patient beautiful proportions. And based in this particular patient, she didn't have much of the ligamentous attachment at the bottom of the buttock. So it was a perfect candidate, not only to touch up the tummy tuck, which was by another surgeon, and also I used the fat for the buttock augmentation for a natural butt lift.
Mm-hmm. And so I'd say with this patient, when you're looking at her before and after, my fear of fluctuations in the future with weight change is actually less now than it was
Very
before.
good.
She seems
Yes.
less disproportionate and less exaggerated. It seems like everything has a little bit of a better flow
Yes.
to it.
I think thank you so much for the question. Actually, it was really good because what happens, I'm going to go on tangent just a little bit. The way the natural butt lift has revolutionized the liposuction is this: two principles. One, we're all born with a certain number of fat cells, right? During puberty, we will add to that number, but that number is constant. It stays the same. So if I have like 3 million fat cells and Mr. X had 2 million fat cells, the number is going to be the same. So when we do the liposuction, the patient will not gain as much weight in the areas of liposuction because the fat cells are literally gone. We have to, as a good plastic surgeon, we have to do the liposuction at the deep layer close to the muscle and leave the immediate subcutaneous fat behind, so it'll give the skin a beautiful feminine texture and natural moisture from under. And we remove the fat beyond the scarpus fascia or the fascias in between the subcutaneous fat and the fat. So that's a good liposuction, and you're not going to gain as much weight in the areas. Now, the reason I say natural butt lift has revolutionized the weight fluctuations after the procedure is these patients will have most of the fat in the buttock, and the fat cells will be in the buttock. So if they have any weight fluctuation, it will be in the buttock. So if they gain weight, they'll see it more in the buttock because
so you just
that's
get
where
a bigger, more
yes.
plump ass.
Yes, even better. Yeah, it will be even better if they have the. So patients, great examples are patients I've done their mommy makeovers, to say it in a better way, the patients I've done their natural butt lift like 10, 12 years ago, and they have babies, and they come like 7, 8 years after to me for their mommy makeovers. Their buttock even looks better because all the weight fluctuation during pregnancy, it all shows in the buttock, or after that, if they had any weight gain, it goes in the buttock.
Right. So I think having an understanding of the proportions of fat throughout the body is part of what makes you a good, fat transfer surgeon. And that common patient or the common myth that you hear from everybody is that they say, okay, well, if I remove fat from this place, doesn't it mean that I'm just going to gain that much more fat everywhere else? And I try to explain to them proportionately, maybe, meaning because you have no fat here, then when you gain, you're not going to gain there anymore. You're going to gain wherever you have the fat, but it doesn't mean that the other fat cells go into overdrive.
Yes.
So they kind of live their normal best life. So
absolutely. The fat cells don't reproduce. So when we gain fat, it's not like my one fat cells become 2, 4, 16, and 256. They don't reproduce. One cell that I have during the weight gain will become larger, and that one cell I have during the weight loss will become smaller. And that's how we see the fluctuations in volume, so to speak.
All right. So you have more hypertrophy than hyperplasia.
Absolutely.
So what are we seeing with this? Lots of extra skin there.
Exactly. So this is one of the patients that, if I can see it, it's very small on my screen, but this is one of the patients. This is a very good example for a staged procedure. So in this particular patient, we have a discussion. As you can see, the stretch, because of the stretch marks, she is a tummy tuck candidate to begin with, right? So, but we can't, at the same time, she has a lot of fat in the broadal area and the upper back. We can't do the liposuction of the broadal area and the upper back at the same time as a tummy tuck because of the blood supply issue that comes into the skin flap. So in these type of patients, what we do the liposuction and fat transfer first, and then second stage, the patient comes back and has their tummy tuck, and that's when we remove the excess skin. It's a great example of a stage procedure.
Yeah, and this is a nice result. And I think when people ask about radiofrequency tightening and things like that, radiofrequency by itself is never going to get this kind of result. This is sorry, I'm saying when people ask about radiofrequency tightening, can you hear me now?
Yes.
Now maybe it's coming through. Okay, perfect. When patients ask about radio frequency tightening, I advise them, something like this is a surgical result. You can't really get this with that. But if you were to use it afterwards, let's say you're going to do profound on this abdomen after, it's going to make the skin quality look a little bit smoother and nicer.
Absolutely.
It's a nice touch up, but it's not going to be doing the majority of the work. So
Absolutely.
this is somebody. How would you describe these shapes? Because it looks like you just flipped her upside down.
Yeah.
No,
I wish I had it. Let me see if I can find these photos. I can't see them clearly. They're very small. I'm looking at them on my phone, obviously, on my Instagram.
Mm-hmm.
Let me see if I can find it on my own iPad. I just don't want to. Listen.
Yeah, because it looks like she's shaped like this in the beginning.
Yeah, so let's talk about this shape. Exactly. So let's talk about this shape. I just wanted to look at my own iPad to see if this was a stage procedure or yeah, I think that's it. Okay, good. So this is, I think this is the patient we're talking about, right?
Yeah, exactly.
All right, good. So in this particular patient, as you can see, the skin quality was really good. There's not much stretch marks. So this is a patient. It's a one-stage procedure, and during that one stage, I told the patient, you're not going to need like a tummy tuck or anything else because you don't have stretch marks. And at the same time, she has a good feminine hip. So that really is what affects our results. So if a patient already comes with a beautiful canvas or something nice to start off with, it makes our job easier. In my particular case, when it comes to the buttock, the patients who come with a feminine pelvis, it makes my job easier because I can give them a better feminine shape because they have the potential and they have that pelvic bone.
So the hips don't lie.
Yeah, no, they don't lie, actually. So in this case, exactly, I removed the fat. As you can see, in some areas, I was a little bit more aggressive. On the sides, I'm a little bit more aggressive. On the lower back, I was aggressive. On the tummy, I kept it conservative, just enough to give her contours of her beautiful muscles. And on the hips, I did a little bit liposuction on the hip as well. And she had a really good frame for the fat transfer. You can see if you turn it. I don't know. Do you have the other slides or no? Do you have the other angles? Okay, I have it here.
No.
Okay, I have it here. I want to point out something about realistic expectation, which you and I know that's our magic word basically, and this is something we love our patients. She has realistic expectations. When I start off with a buttock like this, with a cellulite and irregularity, this is a beautiful result. As opposed to if a patient doesn't have a realistic expectation, or they just think we're magicians, she would not be happy because she would say, "Doctor, I still have these irregularities here. I thought it's going to be completely smooth, but." Obviously, we try to really make sure our patients understand their expectations, their results, their alternatives, and options. So she is not a perfect result. She has a little bit of irregularity, but like any other plastic surgery, the key is improvement, and she has an improvement.
Yeah, and that's what I love to explain to patients too. We're not photoshopping these results. In reality, we're getting huge gradients of improvement, and to get a Photoshop perfect result really is not practical or realistic for most people. It's not reality. So it's definitely good to see those, so you get an idea of what can actually be achieved or what our limitations are. I think these results are pretty impressive in terms of contour and shape. Is this more straightforward, this case?
Yes, this is Exact, beautiful words, straightforward. Because I actually know this patient very well. I operate on many of her family members. She was my first patient. After this, I operated on many of her family members. Because she's young, this patient, she's only 19. Her fat health, she's healthy. She has no medical conditions to begin with. Non-smoker. And she has a very nice pelvis. And this type of body, this type of buttock goes very well with her body type, with her ethnicity, and their fat is healthy. It takes well. It revascularizes. And the most important thing is the patient was extremely motivated. She followed instructions to the T. Like every single thing we would tell her, she would actually reiterate it to us back. Mm-hmm. So it was like a perfect patient from all aspects, because as you know, the operation, like the result is not finalized on the OR table. Then It's the patient's part as well, and it's teamwork. So the good thing is we're all on the same team here.
and when do you think the result is realistic enough to post in a photo, in a before and after photo?
So I think what makes it realistic is for the patients to really look at the before and after. Like you put some examples just now, and if any of these patients showed the other patient that I want that buttock, I would have said, no, you're not going to get a buttock like that. And this is exactly how I say it. Some of my patients who had a consultation with me will be laughing right now. So I'm like, you have to look what your frame is and what we're starting, and we're just going to improve on your body. It's an improvement on your own body, on your own frame. It's not like we're starting off with an empty canvas.
Right. Yeah, I try to tell people for the face, you're not Mr. Potato Head. I'm not taking little pieces and just putting them together.
Right.
You have what you have, and I'm playing only with what you have.
Perfect.
I'm not I don't know how to do anything better than that. But the other thing I was asking is how long until the result is real? Because I see a lot of before and after photos.
Very good.
Or videos where a doctor will just take off the bandage while it's holding the swelling down, and they take a picture and they're like, look at my perfect result. And then 2 years later, that patient's in my office complaining about indents and this and that. And all
Beautiful. Yes.
So how long until you can assume it's until you can assume it's a real result?
Very good. So I think it's the same thing in facial plastics as well. A year is basically the standard time, but all my before and afters are 3 months apart. So if a patient, I don't catch a patient at the 3 month part, timeline, we won't post it because it'll cause
mine too.
3 months, I think it's really good. The swelling 95% down. It's very close to the final result, and it's a timeline that even if the patient tries, the results are not going to change. And I think it's an honest timeline and before and after photo.
And do your patients go through the same phases that mine go through? I have in facial plastics, not my patients alone. They're very excited that first day, second day, third day. When it gets to about a week, they start to get a little bit anxious, sad, and worried, and then it takes another couple of weeks for them to snap out of that. Do you see that with body stuff as well with this?
Well, absolutely. So the thing is, for the first week, obviously the body goes through significant changes. I'm sure in facial plastic as well, you have an extensive swelling, and sometimes the patients actually regret it, and they get too scared, and it's a phase that, especially for the first week. And then usually I tell my patients, don't even look at anything for the first week, because every day there's going to be a significant change. And at 1 week, we go over the results. We go over what happened in the OR in front of the mirror. And then it's at 3 weeks when we start talking about like what happened and where the results are going. And then after that, we're just dealing with the swelling, because at 3 weeks, The incisions are basically healed, and the swelling has gone down enough that we have a good idea where what the results are going to be in a few months.
Okay. And what are these? This looks like very nice waist and kind of hip contouring here.
Beautiful. This is a good example of a mini natural butt lift. So it's good. You showed, it's good. We didn't even rehearse this, but you really picked really good pictures. I appreciate it. You had a stage procedure. You had a butt lift, a natural butt lift, and this is a mini natural butt lift. So as you can see, the results are conservative, and I just worked on her frame. I took fat where it was undesired, the undesirable excessive fat, and I just turned it into stem cells and placed it in a way to give her a shape proportionate to her body. It goes well with her ethnicity, her background, and at the same time, she has all the right contours. But you can see, like this one, we started off with a nice canvas. She doesn't have cellulite, right? She doesn't have the ligamentous attachments that we frequently see at the bottom of the buttock. And she's young. She has good skin elasticity. And that little bit of a fat goes a long way in these patients because the fat is healthy. And again, she's a very well-informed patient, which we all love. And she followed the instructions, and the fat had really good take.
And she's somebody that I look at the frame and the shape afterwards, and even the space kind of in between the thighs and how it looks. And I would never have guessed that she could have had that frame previously if I had seen her. It looks like a completely different infrastructure.
Absolutely. The key is, so another very key point in this particular patient is we make the legs look longer by adding the fat to the side. So to basically address the hip dip. But addressing the hip dip doesn't mean we put fat on the side. We put fat on the buttock, but on the sides of the buttock, not on the hips or the sides of the thigh. So that way the patient proportionally looks much more elegant. It gives her a beautiful hourglass shape. Proportionally speaking, she's going to have a longer leg compared to the torso.
Yeah, and none of these, that we're showing look overdone to me. This one actually even looks muscular. So how does that work?
Again, as you well said, this particular patient, you're having really good example. It seems like you really look at these patients, but you have an eye for it. So it took you probably a few minutes. Yeah, you probably, because the examples are perfect. This is a patient. So a very good point that you put is some patients do work out, even before. So they try all the lunges, squats, they do all there is before committing to surgery. So in this particular patient, she already had a frame, more of a muscular athletic frame, so to speak. So obviously we work on that. And in this particular case, she has more of an athletic shape of the buttock post-operatively.
And what layer is this fat placed on somebody like that?
So the fat is placed exactly over the muscle. So we basically, the best way of putting the fat is, and that's what really differentiates boys from men, so to speak, or a well-experienced plastic surgeon, or someone who just started doing this, or unfortunately, there are non-plastic surgeons doing this, which is a whole nother topic, a complete separate podcast, if you will. But the fat needs to be placed right over the muscle. So as you know, that way it survives better. It gets revascularized much better. And you're not going to have like irregularities due to the fat transfer. So that's where the best is placed. So I put a layer right over the muscle, not inside the muscle, under the muscle, right over the muscle. And I just work on that layer after layer. And we have to allocate this fat very strategically. In this particular case, I have to work on the sides first. Once I make sure I have a nice side based on the patient's frame, and then I go on top, and then I work on the projection to make it as round as possible based on the fat I have.
So a question that is pretty common, you might have to like move your camera so we can see your face again because we're blocking it now. But a question.
What? It's a sticker, right? Is it response to questions? Yeah.
Yeah.
Is that going to go?
People are, no, it'll stay there, but I
oh my God.
But it's asking if you can do BBL awake. And the second part is that there are med spas offering BBL. I think maybe they're talking about injectables. So
yes. So yes, BBL, is it safe? Again, safety is not a matter of being awake or asleep. It's two separate issues. You could have a safe BBL awake or under general anesthesia. It's really the safety comes down to the surgeon. The surgeon's credentials, board certified plastic surgeon. Obviously, if you're double board certified, you have a better understanding of the anatomy and the process. Surgeon's credentials, their training, and I think a main factor is surgeon experience. Before and afters are really good to find a good surgeon. Videos are amazing because it actually shows a better understanding of the result itself. Reviews are good, but I think that safety comes down to the surgeon not being awake or under general. Mm-hmm. And then it says a bunch of med spas offer this, and one doctor and BH2. So again, it's not really the institution you go. If it's a med spa, it's a surgical center who has many surgeons hired by them doing the surgery for them, or is it a surgeon's private practice with his own operating room, which that's you and I have this similar type of practice. Exactly, we have our own operating rooms. It's really the surgeon. It comes down to the surgeon. So if you're going to a med spa, I honestly don't recommend having your butt lift. I mean, maybe for injectables or Botox or here and there, again, by a qualified person, injector or surgeon or physician. But I would look at the surgeon's qualifications and experience.
Yeah, I think patients can't underestimate how difficult fat transfer is, because when I do 10 milliliters of fat transfer, I'm worried about asymmetries, irregularities, and things like that. When you're doing liters of fat transfer, your chance of that is so high. If the person who's doing it is not incredible, you're really putting yourself at risk, because you're not going to get a slam dunk every time. You're definitely going to have, I'd say, a low success rate with most surgeons who do high volume fat transfer. It's really hard to control. So I would really look for the biggest expert out there and do a lot of homework. The other question that we get a lot of is, my doctor said that fat transfer lasts 50% of the time, 60% of the time. What's the take rate nationally?
Yeah, so nationally, it's correct. When you look at different papers or studies or statistics, I think 60% take, meaning 40% absorption is basically the acceptable. But what happens mostly is when you do a high volume fat transfer, we have surgeons, nothing against them. It's just a matter of working. It's not trying to say I'm better or who's better here. But it's just a different taste. It's a different way of doing things. We have surgeons who put 2 liters of fat in each buttock, for example. So the more you put fat, the chances of absorption is higher, because as we said, the best layer for the fat to take or get revascularized and survive is right over the muscle. So you have to really place the fat strategically to, first of all, make the best use of the surface area of the gluteal muscles. So what happens if you put fat over fat over fat and you have multiple layers? Obviously, the central layer will not get as much blood supply. So what happens to that? It either gets absorbed, which it disappears, or it could turn into fat necrosis, and it'll lead to scar tissue and irregularities, which, it's a whole nother complication. So So just like the death rate, for example, I mean, speaking of complications, may be higher in a clinic, which skews the statistics for a procedure, including the fat transfer. Like in Miami, the death rate was extremely high. There was like 8 in one surgery center. Obviously, that tells you it's because of the surgeons in the surgery center. It's not a secret. So you have to really know who you're going to. This is not something that you take lightly. It's a big procedure. It's a life-changing procedure, and it's better done once in a lifetime, basically.
Yeah.
So,
and I'd say with even take rates or predictability, so patients understand it's not that you just take all the fat that you want and then inject it however you want. Exactly. There are surgeons who have consistently asymmetric results on breasts and body because they take the fat and they do one side and they wait an hour and a half, 2 hours before they're doing the other side, and the fat from one side survive better than the other side consistently.
Yeah.
So there's so many factors that go into play that we can't really give it when patients ask, what's the take rate? What's the survival rate? How much of the fat's going to stay? The only person who knows that is the doctor doing it based on all the other ones that they've done. And they can tell you, in my hands, this is what I expect. I overcorrect. I undercorrect. I do touch-ups. It's all doctor specific. So
that's why experience is key. How many procedures, is this the type of procedure that the surgeon does all the time, or is it once in a month, or, absolutely. Totally.
Yeah, and reading the numbers as far as what to expect never helps the patient. They can look all they want. Ultimately, you can only tell by the before and afters and all the reviews. So we're getting to an hour, which means we're going to get cut off by Instagram.
Wow. Okay.
Yeah. So I'll tell everybody.
Wow,
Dr.
it went so quick.
I know, because there's so much to talk about.
It went really quick. Yeah.
So much to talk about. So this interview with Dr. J we'll put up on the podcast and on YouTube. If you want to find Dr. J, he's in my building, so on the Roxanne building. He's just a couple floors up from me. We almost share parking spots. We're right next to each other.
Yeah.
His Instagram name, as you can see here, is Dr. J Plastic Surgery, and website is also Dr. J Plastic Surgery, right?
Yep, drjplasticsurgery.com.
Perfect. All right. So we'll most likely do another one of these if you're okay with it.
Absolutely. It'll be my pleasure, Ben, as always.
Too many questions. We just talked about butts the whole time, so we can see if we can come up with something else.
Absolutely.
All right.
Sounds good. Maybe mommy makeover next time.
Yeah, it'd be fantastic.
Lots to talk about. Thanks so much, Ben.
All right. Yeah. Thank you.